that one particular scenario where somebody has CNS disease, I would, just be upfront about we do have more data with CAR T cells, and I would probably recommend that over bispecifics. Other scenarios, it is more or less individualized. People do prefer, the one and done deal does sound appealing. If you were to, just, have therapy for 4 weeks and be done with it, I think, people like this short duration. At the same time, maybe if somebody is a little bit, more elderly or has, a lot of comorbidities that we worry about, heart disease, things like that, we might say, hey, why don't we do this in a more controlled fashion? Bispecifics is it it essentially divides up the therapy over multiple cycles, and they all have some sort of ramp up or some sort of introductory phase where they give a low dose to try to avoid these toxicities. And the vast majority of them, if not all of them, will require a short hospitalization for the first few doses. So that is appealing. It does give this more or less controlled setting for a patient, maybe like a little stress test to see whether or not they do well with this. So these would be some of the things that go through my mind whenever I see a patient and, I discuss, CAR T versus bispecifics for these malignancies. Right now, I mean, if you look at social media or maybe, if you follow these medical news, you'll see, a lot of noise about secondary malignancies with CAR T cells. There was just a recent publication yesterday about, a patient who, had diarrhea and was found to have a T cell malignancy in their intestines. So, I mean, these are rare events, but sometimes the way they're portrayed, folks might be a little bit more, hesitant about CAR T in general. We don't have the same data for bispecifics. Bispecifics does not include any type of genetic modification. It does not have lymphodepleting chemotherapy. And so one might argue that, these events might be more rare if, more or less non-existent in the bispecific era. So I think that would be another consideration that, somebody might bring up and say, this over that or that over this.